Hello viewers, welcome to this episode of Healthy India. As we all know, liver is a very important organ in our body. It helps metabolize our food, processes the nutrients, filters the blood, and helps build our immunity in terms of fighting infection. Which is why in this program, we had an episode on fatty liver a few months ago, where we went into all the details about the concept and the consequences of fatty liver. So today we are touching upon another aspect of liver disease, that is inflammation of the liver, also called hepatitis. Whenever we add the word itis, itis, that means inflammation. So we're going to talk about inflammation of the liver, which is very broadly of two types. You can have infective or non-infective types of inflammation, so-called infective or infectious hepatitis, which is largely due to viruses, and the others are alcoholic and other kinds of hepatitis. So just to make it clear in the beginning that we are going to focus largely on the infectious kind of hepatitis, but in greater detail as we go along. And to answer our questions, we have very renowned experts in the studio. We have Professor R.K. Dhiman, who is known for his work on hepatitis in India and is currently the director of the Sanjay Gandhi Postgraduate Institute in Lucknow, a place where I also worked for 10 years, from 1988 to 1998. And it's a pleasure to have you on the show, Dr. Dhiman.
Thank you.
And we have Dr. Kaushal Madan, who is a principal director at the Max Healthcare Service in Saket, South Delhi. So we're really talking to two people who are into hepatology, that is a science of liver disease today. So let me start with you, Dr. Madan, with a very basic question. What are the types of hepatitis? As I already said, infectious and non-infectious. But among the infectious variety, there are also several types.
Right.
You want to explain that?
So one way of classifying them is like you did, as infective versus non-infective causes. Another way is to classify them as acute and chronic. Acute means which happens only recently and leads to a lot of problems which last for a few days to a few weeks. And chronic means something which goes on for weeks to months and typically defined as something which persists in the body for more than 6 months. And within the infectious hepatitis, if we say, so there are, if you look at the common forms of hepatitis, there are hepatitis A, hepatitis B, hepatitis C, hepatitis D and E.
A, B, C, D, E.
So you can call it A, B, C, D of hepatitis if you want. So among these, hepatitis A and E usually cause acute hepatitis, whereas B can cause acute hepatitis, but mostly it causes, along with hepatitis C, chronic hepatitis. So which lasts for many years, many months.
So there are several types of hepatitis, of infectious viral hepatitis, which we'll discuss one by one as we go along. But what is the scene of hepatitis in India? We know overall viral hepatitis, the WHO says, is the 7th leading cause of death worldwide. And the numbers are staggering. Dr. Dhiman, we are aware of your work in this area. What is the extent of this problem in India, of viral hepatitis?
As far as the extent is concerned, I would again divide into hepatitis A and E, which is caused by the fecal-oral route, means if somebody is having the bad water or the bad food, and another is the hepatitis B and C, which are basically caused by percutaneous route, means from the bad injections or bad blood also, or maybe through the sexual also. So considering, as already been told you, that hepatitis A and E, they cause the acute hepatitis. If you look at the acute hepatitis, which is usually the appearance of the jaundice, and if you do the test, you get the inflammation over there. And amongst all acute hepatitis cases, hepatitis A is usually caused to the extent of the 30%, and the hepatitis E to the extent of the 40%. And as far as hepatitis B is concerned, as already been told you, that it can cause the chronic infection also. So I will talk to you the chronic infection. Usually after acute hepatitis, in 5% to 7% or maybe the 3% of the patients, the infection becomes the chronic, and India comes under the intermediate zone as far as the worst scenario is concerned.
Okay.
So it is 3 to 5%.
Of?
Of the, if you examine 100 persons for the hepatitis B, 3 to 5% would come positive for the HBsAg.
That's
that
very high.
signify it is the intermediate. If you are talking about the very high, there are the countries like China, Taiwan, and the Mongolia, where it is about 10%. And the main issue is because why they are having so much, they have the vertical transmission, that is mother to the baby. Here we have the horizontal, most of the infection occurs during the childhood period with 5, 7, or in the adult phase also. And if you look at the hepatitis C, that is something we are in the low prevalence rate countries also. On an average in India, it is less than 1%. So it varies 0.1 to I would say 5-6%. I'll give you an example of the Punjab where I have worked actually. The prevalence is 3.62% there. And if you consider the population of the 30 millions, that is the 3 crore, so there are more than 10 lakhs patients who are antibody positive. And if you say that the active infection means virus is positive, that is around 8 lakhs. When I left the Chandigarh, we have treated more than 1.5 lakhs patients over there.
So for those of you who may not know, Dr. Dhiman was at the Postgraduate Institute in Chandigarh where he did pioneering research in this area. And now, as I said, he is director at the Sanjay Gandhi PGI Lucknow. Dr. Madan, you have a lot of experience with liver patients. Within gastroenterology, you've chosen hepatology as your main area of work. Let's do quickly, these different types of hepatitis in a couple of lines each. So what about hepatitis A?
Right. So, like Dr. Dhiman said, hepatitis A is spread by fecal-oral route. So, it is among those two viruses, hepatitis A and E, which are spread through fecal-oral route and causes acute hepatitis. Very rarely, say in about 1% or even less, patients may develop such severe inflammation that may develop liver failure, which may become life-threatening. Important thing is, I think when we talk about public health point of view, I think the important thing is of prevention. And hepatitis A, since it spreads through fecal-oral route, so safe hands, safe water, safe food primarily prevents this kind of hepatitis. And we also have a vaccine available for hepatitis A. So people who are not vaccinated should get vaccinated for hepatitis A. Second, there are countries in which hepatitis A vaccination program is part of the universal immunization program. But right now in our country as a policy, it is not. But in general, most people, most children when they are born do get hepatitis A vaccination.
Even though it's not part of, not a mandatory part of the program yet?
Not mandatory part of the program.
So I come to you, Dr. Dhiman, now, and we'll talk about hepatitis B. As Dr. Madan explained, hepatitis A is usually less severe and doesn't result in chronic liver disease. But very importantly, it's quite preventable just by safe water and hygiene, and that's very important. What about hepatitis B, Dr. Dhiman?
If you permit me, I will discuss two viruses, hepatitis B as well as the C, because as far as the transmission is concerned, that is the same. And another third important virus, that is the HIV. So whenever we talk of the one virus, so we also take care of the other two viruses also. Whether
so preventive strategies will work
for
against
the preventive strategies, for the treatment strategies, for everything, I would say. So as far as the transmission is concerned, I have already told you it is not the fecal-oral, but it is either through the blood or through the percutaneous route, or this is through the sexual contact or the mother to child. Percutaneous is very, very important. There are several surveys have been done where it has been demonstrated it is the unsafe injection practices which is spreading these viruses, particularly in the Punjab that we have seen and in other states also. What you call the quacks. You go for the pain, they give you the injection. If you go for the fever, they will give you the injection. And more importantly, they don't change the syringes also. So between the persons, they are using the single syringes also. And similarly, the population who injects drugs, people who inject drugs, that is the another one.
So drug users,
Drug users,
addicts,
yeah.
yeah.
You must have the Udta Punjab, you must
Yeah,
have
yeah,
seen
yeah,
and they have shown the problem of the
Yes.
drug use in the Punjab also. So that is another very important, where they can cause not only the one virus but the multiple viral infections also. And besides this, the piercing the body, for example, for the ear piercing or the tattooing or even shaving in the common areas also. That is the thing. And the mother to child, I would say, the hepatitis B virus, it is very easily transmissible. So there are the preventive strategies that we can talk of about that one. And the last is the sexual also. The hepatitis B very easily transmitted also. On other hand, hepatitis C, the infection rate through this route is very less than 5%, particularly if there is a monogamous relationship. If somebody is having the promiscuity, then it increases, or somebody is HIV infection, means immunocompromised state. So these are the things that determine the transmission of the hepatitis B, hepatitis C, as well as the HIV. Now I am coming to the hepatitis B, as you have asked me. Somebody gets the infection, so what will happen to it? 100% if get the infection, so what will happen? 2/3 of the time the infection is asymptomatic. Any symptom, if there is symptom, it is a mild symptom, for example, the cold-like symptoms only. Only it is 1/3 of the time that there are the symptoms, acute hepatitis in the form of the jaundice, yellow color urine also, as well as the yellow coloration of the eyes. So this is the icteric. And out of these 100 persons who have this infection, approximately 95% of the time the persons cleared the infections, means the main marker, which is called as the HBsAg or the surface antigen, they cleared the infection and they developed the antibodies, which are the protective antibodies, and they remain lifelong. So person once get the infection, he is immune for the second infection also. But this is only the 3 to 5% of the time. The infection persists and it becomes a chronic. When we say the chronic, means infection is persisting more than 6 months. That is very, very important. And I'll go, what will happen to these persons who have the persistent infection? 20% of them, they develop the cirrhosis, and the development of the cirrhosis rate is 3 to 5% per year. And more importantly, I would like to tell you, the cirrhosis, once there is a development of the cirrhosis, it is a fertile line for the development of the liver cancer. In addition, hepatitis B directly can also cause the liver cancer also, and the rate of the development of the hepatocellular carcinoma in this setting is 2 to 4% per year. I mean to say that is a very important public health problem also. If somebody becomes the chronic also, then they develop the cirrhosis of liver, which is a hard liver, जिसको कहते हैं ना कि सख्त हो गया liver, and it becomes a land, fertile land for the development of the SCCs. Somehow, if I discuss the same in the same breath, what happens to hepatitis C? 100 patients who get this infection, there the chronicity rate is 70 to 80%.
So hepatitis B chronicity rate is lower.
Much lower.
Most of them are cleared out by the body.
95%.
Here, but the consequences are very severe for those who are persistent.
In 1/3 of the person.
Yeah. So yes. in hepatitis B. In C, on the other hand.
In the C, on the other hand, the 70% they become the chronic.
Very important.
And development of the cirrhosis in these persons are 20% after 20 years of the infection, 30% after 30% of the infection. And the development of the SCC, as I already told you, once there is a cirrhosis, it is a fertile land for the development of the liver cancer. Again, the rate is the same as in the hepatitis B, that is the 2 to 4%. So this is very, very important. I have just told you the natural history.
Yeah.
Once these patients, they develop the infection on a chronic basis.
So on that note, we'll take a short break and be back with you soon with more information about viral hepatitis.
हाइपरसोनिक तकनीक को विकसित करने में कितना बना है आत्मनिर्भर।
अब हाइपरसोनिक इज 5 गुना ज़्यादा ध्वनि का गति वायु में, दैट इज इट इज़ अप्रॉक्सीमेटली 1.6 किलोमीटर्स पर सेकेंड। हमारे पास हाइपरसोनिक वेपन 3 या 4 साल में होगा हमारे फोर्सेस के पास।
देखिए संसद टीवी का खास कार्यक्रम स्पेशल रिपोर्ट रविवार शाम 7 बजे।
Welcome back to our discussion about hepatitis. So continuing with the alphabet of hepatitis, we've talked about A, B and C, and I go back to Dr. Madan about the D and the E. Would you like to enlighten us about that?
Right. So, as we discussed earlier, like hepatitis A, hepatitis E is also spread through fecal-oral route. And if we go back to the history of hepatitis in India, I think one of the earlier epidemics of viral hepatitis were because of hepatitis E. And if you ask me today, based on data, the most common cause of acute jaundice or acute hepatitis is hepatitis E in our country. On the other hand, hepatitis D is a partial virus, is a defective virus. It cannot cause an infection on its own. So it piggybacks on hepatitis B. So it is never found alone. So it will be found only in those patients who have underlying hepatitis B. Either it will simultaneously go in the body along with hepatitis B, or in a person who already has hepatitis B, it will have a super added infection. But fortunately, we find hepatitis D to be a very, very rare cause of liver disease in India. However, it may be a common cause of chronic infection in some other countries like Central Asian countries, but not in India.
So Dr. Madan, some of these cause acute hepatitis, like A and E, where patients present with jaundice, fever, इसको हम लोग पीलिया बोलते हैं,
Exactly.
या बुखार आता है, या दर्द होता है, या मतलब डिस्कम्फर्ट होता है। पर इसमें जैसे डॉक्टर धीमन बता रहे थे, कुछ ऐसे ग्रुप्स हैं which are actually the more serious ones, B and C, उसमें कैसे मैं पेशेंट हूँ, मैं जानना चाहता हूँ, मुझे कैसे पता लगेगा मुझे हेपेटाइटिस B या C है?
I think this is a very important question which you have asked, and I think a message should go out through this program regarding this. One was very simple, that a patient presents with acute hepatitis like any other viral illness, even like a flu. You will have flu-like symptoms and then you will develop jaundice. Or pain abdomen, nausea, vomiting, yellow urine, itching. So these are symptoms of acute hepatitis. But when it comes to chronic hepatitis, since it stays in the body for years to decades, it may not cause any symptoms for this lag period of time. So that is why in many parts of the country, these two viruses are also called silent killers. So if you ask Dr. Dhiman, he will tell you in Punjab, hepatitis C is also known by the name of Kala Pilia, as a corollary to Safed Motia and Kala Motia. Kala means more dangerous. So hepatitis C in various parts of our country is also known as Kala Pilia. And the main reason is that once the patient starts showing symptoms, it is already too late. They already have developed cirrhosis or a complication of cirrhosis. So short of these symptoms, it is very difficult to diagnose. Only way to diagnose them is do screening. Either it can be a mass screening or it has to be a screening of high-risk groups. For example, high-risk groups being the medical health workers, the commercial sex workers, patients who use drugs, technicians who work in a blood bank, patients who undergo dialysis regularly. So these are the high-risk groups who should be screened for these viruses rather than patients developing symptoms and coming to a doctor when it would be too late.
तो ये जानना बहुत ज़रूरी है कि जो ज़्यादा सीरियस प्रकार की हेपेटाइटिस हैं उनके लिए टेस्टिंग बहुत ज़रूरी है। जो लोग ऐसे एरियाज़ में काम करते हैं जहां उनका रिस्क ज़्यादा है, उनको टेस्ट करना चाहिए एज पर प्रोटोकॉल, जिससे कि ये बीमारियां जल्दी पकड़ी जा सकें, इसके बजाय कि जब पीलिया और उससे उस तरह के सिम्टम्स आने शुरू हो जाते हैं तब तक पहले ही देर काफ़ी हो चुकी होती है। तो ये हमें ध्यान रखना ज़रूरी है। जबकि जो अक्यूट हेपेटाइटिस होती हैं वो तो नॉर्मल बुखार और वायरल फीवर और पीलिया से प्रेजेंट करती हैं। डॉक्टर धीमन, व्हाट obviously the burden of hepatitis is very high, and it's also obvious from our discussions that much of it is preventable. And there are two broad routes you've told us. One is the transmission through water, through the contamination by feces or through the mouth, and the other is typically by blood touching, or getting under the skin. So how do you make an overall plan for prevention?
I think it is a very important question, and I totally agree with you that this viral hepatitis is a very serious public health problem, and we have to deal with it. Coming to those viruses which are caused by the orophycal route, that is the hepatitis A and E, the common sense dictate that we should have the safe water supply also. For example, जैसे सब्जियाँ आती हैं उनको धो के खाएं, ऐसे ना हो कि without washing them and we start eating as a raw also, or they should be the cooked also. That is something you can prevent the waterborne infections. Now coming to specifically the hepatitis B also and the hepatitis C, the difference between two is that they can cause the chronic illness and they can damage your liver and they can cause the liver cancer. And they can cause the lots and lots of the admissions also, hospitalizations also, and ultimately the death. So there are the financial burden to the government as well as to the society also, as well as the burden on the caregiver, those who are giving the care to these patients. So the prevention of these viruses is an important aspect as well as the management of hepatitis B virus as well as the C virus is concerned. Between these two, I would say the vaccine, if a very effective vaccine against hepatitis B virus is available. Somebody has said the prevention is better than cure, and I would say that everybody should get, this is a message also to the public, that everybody should get vaccination against the hepatitis B. It is available everywhere. Only the 3 shots have to be given to begin with, that is the 0 day, and the second shot after the 1 month, and the third shot after the 6 months. The dose is 20 microgram. It has to be given within the muscle. We call it the intramuscular also. But look at it. The infection can happen at the time of the birth also, if the mother is positive, or at the age of the 5-6 years when the children play with each other also, they can have. So the government of India has included the hepatitis B vaccination in national vaccination program also. At birth, within 24 hours or before the time of the discharge, the first shot has to be given. And the subsequently 3 doses has to be given as a part of the tetravalent or the pentavalent vaccine. When I say the pentavalent, then it is the DPT, it is the hepatitis B, and then it is the influenza vaccine also. They are given at 1.5 months, 2.5 months, and the 3.5 months, and that completes. So I think those who are listening to me and make sure that the children get the vaccination, that is very, very important.
I think this is very important information जो डॉक्टर धीमन ने बताया डिटेल में हमको वैक्सीनेशन के बारे में और किस तरह हम इन बीमारियों से बच सकते हैं, और जिनको अगर हम निगलेक्ट करेंगे तो वो बहुत सीरियस भी हो सकती हैं, सिरोसिस और इवन हिपैटोसेलुलर कैंसर की तरफ जा सकती हैं. वी आर रनिंग आउट ऑफ टाइम एंड आई वांट अ 2-line आंसर फ्रॉम डॉक्टर मदान. ये तो सब प्रिवेंशन सबसे इम्पॉर्टेंट है, लेकिन अगर हो गया तो, क्योंकि आई एम अवेयर दैट देयर आर लॉट ऑफ एडवांसेस इन एक्चुअली ट्रीटिंग हेपेटाइटिस ऑल्सो. So can you just enumerate, because that's really beyond the scope of general public, but still.
Right. So I think again that's an important question, because there was a time when people used to think once you have hepatitis B or hepatitis C, that's like a death certificate for future, but that is not true now. So let me again divide it into 2 groups. Acute hepatitis, just supportive management, 99.9% patient will recover on their own. Chronic hepatitis, hepatitis B, we have drugs, both injections as well as oral drugs, but the oral drugs are preferred both by the doctors as well as patients. 1 tablet a day for for a few years, maybe many years, maybe lifelong, and you are prevented, you are protected from all those complications which Dr. Dhiman just enumerated, like the outcomes of chronic hepatitis such as cirrhosis, liver cancer, liver failure, need for transplant. And I think the biggest discovery, there was in fact a Nobel Prize last year for discovery of hepatitis C, and from there we have reached a stage where now we can boast about cure for hepatitis C, and this has happened over last 5 years because of the advances in the molecular biology. And now we have drugs available in which a single pill has to be taken every day for 8 to 12 weeks, and 99% of cases will be cured of hepatitis C. So that was in short about
That's
treatment.
very, very valuable information. So we end this session on a very encouraging note. The fact that yes, hepatitis is very common in India. It can be a very serious disease. It's a major public health problem. Yet, much of hepatitis is preventable by general measures and by excellent immunization protocols that Dr. Dhiman told us. And what Dr. Madan told us in the end, that even if you do fall prey to hepatitis, the truth is that there are considerable advances in treating them. So I think we end on this positive note. Thank you for being with us. See you next Sunday on Healthy India.
सच्चा